Okay, so now my phone is recording. I knew one of them was going to record. Okay, so let me start this one over again. This is a counting tray. It has a couple of parts to it. It has the area where you count the pills. It has this well here that you put the pills into as you're counting them. And it has this little lip here that you use to pour the medication you don't need back into the stock bottle. We use it with a counting implement. This looks like something you would spread butter on toast with. It's a little spatula, and that's exactly what it is, and it works pretty well for that. So let's say that I wanted to count 30 tablets. So I would take my stock bottle, make sure that the NDC number is the one that I want. I would scan the barcode on it. That's weird, this one doesn't have one. I would scan the barcode into the computer, check the expiration date and the lot number to make sure that this is a product I can use, it's not expired. And then I'm gonna pour more than 30 onto the counting tray. And after a while, you get pretty good at estimating what you think is 30 or more than 30, or however many you want, because you've done this a lot. And then I like to shake it like this to get the tablets in one layer. Okay, so then I take my spatula and I count by fives. And a lot of times they'll fall naturally into these patterns of 3 and 2. So if you can see this right here, I've got 3 and 2 together. So that way I don't have to count each individual 1, 2, 3, 4, 5. It kind of makes a little fan shape. And I can go 5, 10, 15, 20, 25, 30. Now I use the little spout thing. My camera goes back to my home screen every now and then. I use that to pour the ones that I don't need back into the stock bottle. Lay the tray down, put the lid on, and then I take the bottle that I'm going to give to the patient, the dispensing bottle, and you can pick it up like this, and holding this well, holding the lid closed, you tilt the tablets into the bottle. So it's really pretty convenient. And you put the lid on. If you want to count them twice, let's say this is something like hydromorphone or Adderall or morphine, something that you want to make sure you counted correctly, you can pour them back on the tray and do your second count. 5, 10, 15, 20, 25, 30. So that's 30 tablets. Okay, so that's how you use a counting tray. Does anybody have any questions about that?
No.
No questions?
No, I don't have a question.
Okay. So I can unshare my screen. There we go. Okay. So this seemed to work pretty well. I've done screen sharing with math last semester, so I know it worked pretty well. I was just trying to do something different with math this semester, and I didn't think I'd have to use my phone, but hey, there it is, it works, so that's good. All right, so we're gonna look at chapter 5 today. So let me pull it up for you guys. And let me see if I can then share this screen. Okay. Okay, are you guys able to see that for chapter 5?
Yes.
Okay. So this is dosage forms and routes of administration. We're going to go back and do chapter 2 in a couple more weeks. Okay, so this introduction doesn't seem like that it matches the chapter, but I've checked it out and it actually does. Okay, so basically, we get orders in different ways in the pharmacy, especially in outpatient pharmacy. Sometimes patients bring us a handwritten prescription, and other times we get that faxed to us. We still use fax machines. Sometimes it comes electronically to a computer program to us, and we have to interpret and clarify these orders. And then a lot of the abbreviations that they use look a lot alike, as you know from chapter 1 with that do not use list. They still use a lot of those abbreviations, so we have to know what they are. So if you get a prescription that, that you don't know exactly what it says, you need to call the doctor's office and clarify that. Now, what we used to do is we would tape the prescription onto a regular size piece of paper that fits in the fax machine, and we would fax it to the doctor's office and put clarify route or clarify dosage form. And then they would fax it back to us with the clarification, and we would make sure that we put that with the original prescription and file it away with a hard copy in our hard copy file. So where did all these abbreviations come from? And a lot of them come from medical terminology, and medical terminology comes from Latin and Greek languages. These are universal languages in medicine. Pharmacy in America began in Europe. So I always have to say that, pharmacy in America, because there was pharmacy in a lot of Asian countries way, way before America was even a country. And a lot of pharmacy in Asian countries started before Europe also. But for us, of course, because we were originally a British colony, a bunch of British colonies, so we go with the European. So most abbreviations have their origins in foreign languages, and a lot of those were Latin and Greek, especially Latin. So we have to be able to interpret these orders when we get them. And some of our prescriptions look really weird to people who don't work in medicine. If we're writing out these various abbreviations, we want to make sure we write as neatly as possible, because other technicians and pharmacists will be reading your handwriting. We don't write out prescriptions as a general rule. If we get a prescription phoned in verbally from the doctor's office, we, in California anyway, we are not allowed by law to take that down and write it as a prescription. We have to give it to a pharmacist, a licensed pharmacist, to take that prescription and what they call it, they say reduce it to writing. They write it down as a written prescription. But we still have to be able to do it. I did have a pharmacist who had a hand problem. They broke their hand. And so I had to actually write everything, and then she took her left hand and very poorly made her initials on that written prescription to show that she approved it. And I was just basically taking dictation from her. So we have to learn all of these abbreviations anyway. The Institute for Safe Medication Practices came up with this do not use list, because these are the most common things that are mistaken and errors that are made. So we want to avoid these abbreviations as much as possible, but you'll still see them. Okay, dosing times are abbreviated on prescriptions, and a lot of pharmacy computers are programmed to accept these abbreviations. So if you're typing a prescription in the pharmacy, it's going to take a lot longer to type out, take 1 tablet by mouth 3 times a day with food. But if you type TTPOTIDCC, then that's going to come out a lot faster, and your computer is going to know those abbreviations mean the same thing. Okay, and then we have classification of medications. Classifying medications puts them into groups. So a lot of these groups are based on their pharmacology, what they're supposed to be used for, the route of administration, the mechanism of action, which is how they work in the body, or the body system affected. Is it for heart and lungs, or is it for blood pressure, you know, that type of thing. So as far as medications that are available to consumers, there's some that are called over-the-counter drugs, OTC, which means you do not need a prescription to purchase them, like this bottle of ibuprofen. I did not need a prescription. I could walk into Walmart or wherever and buy ibuprofen. Legend drugs are drugs that require a prescription, and they're called legend drugs specifically for something that is written on the bottle. And then behind the counter drugs, BTC, this is the third classification of drugs. And this came about a few years ago. These are things that you have to walk up to the counter and ask for, like the emergency birth control is one of the first ones that came about. The one that came about right before that was pseudoephedrine. When they made pseudoephedrine an over-the-counter controlled substance, which is really strange, and decided that people could only buy a certain number of tablets, then that became, in California at least, the first behind the counter drug. And the reason they did that is because pseudoephedrine is used to make methamphetamine, which just fuels the illegal drug trade. So, you know, you can turn that into a dangerous, very dangerous substance quite easily. A lot of people do, you know, they make meth. Okay, the dosage form is what shape is this drug in? You know, is it a tablet like this? Is it a liquid? Is it a capsule? So all of those things are different forms of the drug. It's the physical form of the drug. It's determined primarily by which form makes the drug more effective. So for instance, you can't take a pill and inject it, right? It has to be a liquid in order to inject it, and it has to be a sterile liquid. So manufacturers prepare certain medications with the ability to release the active ingredient over an extended period. Drugs have what is called a half-life, which is how long it takes for the body to process and get rid of half of the amount of drug that was taken. So if you want something to last a long time, if you have a drug that would normally your body could flush it out within 6 hours, but you really want it to last 24 hours, then you make it in extended release form. So we're going to talk about that in a little bit here. So the three major categories of dosage forms are solids, liquids, and semisolids. Solids can be contained in different packaging, and they can be administered by almost all the routes except parenterally. So the word parenterally means given by injection. The word parenteral means bypassing the enteral tract or the GI tract. So parenteral means above the GI tract or away from the GI tract. So any parenteral drug is not taken by mouth. And so for us, what we usually take that to mean is injected somewhere in the body. Most tablets contain fillers. Fillers are also called excipients, and these are substances that have no active ingredient, things like talc or cornstarch or something to give the tablet a form so that it will stick together and you can form it into this shape. Now, a lot of tablets are made in like a paste form and then they dry, and then they put a coating on them, and the coating keeps it from falling apart in your mouth, because a lot of tablets are very bitter. A lot of drugs actually are very bitter and they don't taste good. So they could put a sugar coating on it to make it taste better. They could put a coating that's kind of slick to make it slide down your throat better. This ibuprofen has a coating, but the coating is easily dissolved. It's not a really good coating. And you can see it's kind of matte. It's not shiny. It's kind of non-shiny coating. Now the brand name Advil is a similar color brown, but it's very shiny. And I have one of my kids doesn't like the generic ibuprofen because he says it sticks in his throat, and he buys the brand name Advil, which is more than twice the cost. But for him, that's what he wants. So, you know, that's what he buys. It's worth it to him because he says it slides down his throat easier. So, you know, everybody's different in what you like and don't like. I will say, however, that in the US, generic medications by law have to contain the same active ingredient, and it has to pass several other tests as well. It has to go through the body at the same rate of speed. It has to release the same amount of medication as it's metabolized. So it has to be within like 5% of the time frame of the brand name, or it can't be sold as a generic in the US. So for us, our generic drugs, there are some fraudulent generic drugs out there, but for the most part, if they come from drug companies that we know and trust, then they're pretty good products. You know, they work just as well as the brand name drug, and which is why I buy the generic in bulk, because for me, it doesn't make sense to buy the brand name and spend a lot of money on it when it works exactly the same. So, okay, so there's additives in it that keep it in its tablet form and help it dissolve once it gets in there. So there's different tablets. Some tablets can actually be administered sublingually, which of course means under the tongue, or vaginally. There's vaginal tablets which dissolve in the vagina. Some tablets could be scored, which means the drug could be cut in half or even broken in half. A lot of them are enteric coated. And what this means is when you take the drug, it doesn't dissolve in the hydrochloric acid that's in the stomach. It dissolves in the small intestine, which is not acidic, it's more base, it's more alkali. So the reason for that is they don't want the medication to break apart in the stomach. They want it to go through the stomach in the small intestine and then start working. So it delays the release of it. Now, the other thing it could do is it could partly dissolve in the stomach, and then there's a layer inside the part that dissolved, and that layer inside will dissolve in the small intestine, and that makes it last longer. So it doesn't dissolve in the stomach, dissolves in the small intestine. There's chewable tablets, which of course, if you chew them, they're going to dissolve right away. So chewable tablets cannot be extended release. The most common type of tablet contains some type of filler. Another word for filler is excipient, and that's going to come up here shortly. It can also improve the taste, and it could also cover an unpleasant odor. Some tablets, you open the bottle and you could almost smell rotten eggs, because that's, you know, in the makeup of the ingredients, that doesn't smell good. So if they coat it with something, there was a drug company, I think they're still around, called Letterly. And Letterly, all of their pills smell like vanilla. And that was kind of pleasant. You know, you open up this erythromycin, which erythromycin in real life does not smell good. It smells kind of that rotteny, eggy cut smell. But no, you smell vanilla. So it's nice and pleasant, and people like to take them. There's something called caplets. Caplets are tablets that are shaped like a capsule. So they're long and narrow and kind of ovally shaped. Capsules can either have a hard or soft outer shell. The hard capsules are composed of sugar, gelatin, and water. So I have to talk about gelatin for a minute. Gelatin can be made from, they used to make it from calves' feet, from the hoof part of the calf, because it contains keratin, and the stuff that makes up the hoof will turn into gelatin. So, of course, for people that are vegan, people that are against that sort of thing, or they only want vegetarian, there are capsules that are made from vegetable gelatin. And so there are gelatins that come from plants. So this is what a lot of companies are using now, is this gelatin from plants. And it's just because it's, you know, whatever, kinder to the environment, or for people that prefer not to have gelatin from animals. Now there's a pulvule that's a capsule that's shaped, it says it's shaped differently for identification purposes. It's basically shaped like an egg instead of shaped like a long, narrow capsule. Okay, a spatule is a capsule that can be pulled apart to sprinkle the medication onto food for children. And then there's soft gelatin capsules. These are called gel caps, and you can't pull them apart. And a lot of times they have an oily liquid inside, and that's the medication. Then we have something called a troche or troche, depending on how you pronounce it. I've heard it pronounced both ways. This is a tablet that dissolves in the mouth, and they kind of taste, well, they're similar to the little Necco wafers, but they have fruit flavoring in them. Usually it's very, very mild flavor. So the little Smartie candies or the Necco wafers, those are like troches. And they're flat and they dissolve in your mouth. So there's a particular drug called Miscellaneous. A Miscellaneous troche is for a yeast infection in the mouth. So it goes in the side of the cheek, and it dissolves in the mouth, and the patient swishes it around their mouth and swallows it, and that takes care of that yeast infection in the mouth. Then we have things called biomaterials. These are polymers or long chains of hydrocarbons that combine with or encapsulate a drug. Excuse me. These biomaterials can be made into capsules, tablets, or implants. And they can be activated by pH or the solubility, and they can be released over a period of 12 hours to several years. Some of the things that, that are like implants, like the birth control that gets implanted in the arm is like that. It can last anywhere from 3 to 5 years. Implants are a type of capsule that can be implanted under the skin and left in place for up to 5 years. Most of the time, those contraceptives contain progestin, and then the medication is released in a stair-step method, like it released some now, and then some more later, and then some more later. Okay, a patch, of course, is a little square or circle. It usually looks like fabric, and the medication is embedded in that, and then there's adhesive gel that's under that, and so it releases into the skin over time. And this makes people not have an upset stomach. It's very common for people to have upset stomach from taking medications by mouth. So some of these things are a scopolamine patch is a very small round patch that goes right behind the ear on that bone there, and it lasts for 72 hours. And they use that for motion sickness. Then there's something called Duragesic. Duragesic is fentanyl, which is the strongest painkiller we have right now. And that's a little square patch, and it's different sizes depending on how much medication is in it. And it can go anywhere on the body, but they usually put it somewhere on the chest. And that's a chronic pain patch. And then there's a patch called nitroglycerin, and that's for angina. So that's the one that took 120 years to figure out how it works. So nitroglycerin is the same thing that's in dynamite, and it's been around forever, and it helps with chest pain due to the blood vessels that supply blood to the heart getting squeezed due to some different things. And so it opens up those blood vessels. So it's a nitroglycerin patch. Liquid medications is usually called a solution. This can be administered by all of the routes. You can put a solution, there's a spray that goes under the tongue. Of course, you can drink it. You can have a teaspoon of medication. You can rub it on like a cream or an ointment or a lotion. A lotion is a lot more liquidy than creams or ointments. Of course, we can inject liquids. So the syrups are usually sugar-based. Now, they make sugar-free syrups as well. Syrups also thicken the medication, which makes it easier for some people to swallow. The medication is dissolved in the syrup, and of course, it's meant to improve the taste of the drug more than anything else. Syrups tend to be thicker than water. An elixir contains dissolved medication in either an alcohol base, which would be like a hydroalcohol, or an alcohol base. Alcohol usually covers up the bad taste of the drug. Some medications that contain alcohol, the alcohol actually works as a medication as well. Alcohol tends to ease pain. It tends to act as a relaxing agent. Alcohol is like a muscle relaxant. And it also helps preserve the medication so that it lasts longer. However, alcohol, of course, is not good for people to take if they're small children, or if they are like alcoholics and they don't want to take alcohol. Some people just don't want to take alcohol anyway, especially if they're going to go drive somewhere. They don't want to take a lot of cough syrup with alcohol because they could actually get pulled over and charged with drunk driving. So a lot of medications now don't contain alcohol, but if it's an elixir, elixir has the same consistency as water, but elixir is an alcohol base. Okay, so that usually shows up on one of the, on some of the national exams. It will say something like, which solution contains the most alcohol? And then it will say syrup, suspension, elixir. It's going to be elixir. Spirits are aromatic solutions of drugs that are designed to evaporate quickly. So spirits are usually placed on top. Something like that would be like rubbing alcohol is a spirit. A spray contains different substances like alcohol or water in a pump type dispenser, and nitroglycerin translingual spray is the one that is sprayed under the tongue. Then we have things like inhalants, like a nebulizer, the puffer that people use when they have asthma, and that can be inhaled into the lungs. Some of them are over the counter. And some of the common devices that you can just walk into a drugstore and buy are like vaporizers and humidifiers. And what they vaporize is usually just water, but it could be that they put something sort of menthol-y in there to make it smell good and to also help people feel like they're breathing better. Respiratory therapists use nebulizers to give breathing treatments to hospital patients, and patients can be taught to use nebulizers at home. An anesthetic is an inhaled solution administered by an anesthesiologist during surgery. It makes people go to sleep, basically, so that they don't remember the surgery. MDI stands for metered dose inhaler, and metered means measured, okay? Metered is the same thing as measured, because every time they press the spray, they get the same amount of medication. So that's why it's metered. An emulsion is a mixture of water and oil. Now, water and oil don't normally mix. They won't mix. So you have to have an emulsifier, which is something that's used to bind the two things together and keep them mixed together. So like Italian dressing, you know, if you buy a bottle of Italian salad dressing, it's going to have oil on top or oil on the bottom and all these herbs and things floating on top, right? So you have to shake it up really well before you use it. But if it has an emulsifier, then it wouldn't separate like that. A suspension is a liquid in which very small solid particles are suspended in the base solution. This could be used by children. They use it mostly for children, like the pink stuff that you give kids, amoxicillin, for when they have an ear infection. That's a suspension. But adults can use it too. And they always have to have a shake well sticker and an expiration date on those. One of our labs that we normally do that I'm going to try and do toward the end of the semester is I'm going to see if I can bring a few of you in at a time to the classroom where we will distance, of course, and then reconstitute a bottle of amoxicillin. It's not real amoxicillin, but it looks the same. And then you can learn how to mix that properly so that it has the correct amount of liquid total at the end of it and that it's completely shaken up. So we'll do that a little bit later in the semester, I'm hoping. Okay, an enema. An enema is a medication that goes into the lower bowels through the rectum. And it could be administered for two reasons. The first one could be a retention enema. A retention enema, because the rectum has a lot of blood vessels and medication gets absorbed easily through them, but it's not always the same absorption. Absorption can be sketchy depending on what else is in the rectum. So a retention enema is one that they want the patient to keep for at least 30 minutes so that those blood vessels can absorb the medication. Now, let's say that someone is going through chemo treatment and they need a medication, but everything you give them by mouth, they vomit. If you give them an injection, maybe they don't want an injection, or they're not going to feel right, or they already have pain and they don't want an injection. So you can use an enema to give medication, or if they have sores around the rectum, you can use the retention enema directly on those sores, and especially like rectal fissures and things like that, which are little tears in the rectum, or hemorrhoids. So retention enema needs to be retained in there for at least 30 minutes, and then the patient can go to the bathroom and evacuate it. An evacuation enema can be used for up to, say, anywhere from 5 to 15 minutes, and that can be used for patients that are constipated, and then they go to the bathroom and it helps evacuate everything in the lower bowels. So the most common use of enemas are to evacuate the lower intestine, which means it helps them go to the bathroom, it helps them defecate, or it helps them get rid of poop, to put it in layman's terms. And that helps them prepare for surgeries or for women in labor, because women that are in labor, oftentimes they have constipation during pregnancy, and it just makes the labor worse unless you evacuate that first. Semisolids contain both liquids and solids, and these are meant for topical application. Topical means on top of the skin. Okay, so creams are medication that are in a base that's part oil and part water, and those are for topical use. Ointments are a lot more oily, and ointments sometimes have a shiny surface once you put it on. Now there's reasons why you might want a cream instead of an ointment, or an ointment instead of a cream. Ointments tend to be more protective because they coat the skin with the Vaseline jelly type. It's like a petrolatum or petroleum jelly, and it protects the skin so that, like for diaper rashes, when the baby urinates, then the urine doesn't get on the skin because the ointment is in the way. So it protects it from getting a rash due to urine. Lotions are thinner than creams because the base contains more water. So lotions are thin creams that you can put on to like moisturize the skin or protect it from losing moisture. Okay, ointments contain a glycol or oil base, and they cover the skin's surface and keep out moisture. Now there are things that are called gels. Gels that are medications in a thick, viscous liquid that easily penetrate the skin. There's something called a paste or a salve. Salve is another word for it. It contains a smaller amount of liquid base than solids, and so a paste is kind of thick and it sits on top of the skin and it's hard to wash off. We have some pastes at the hospital that are used for patients that have severe rashes, and it totally covers it so that nothing can touch the skin. And then in order to get it off, you have to use mineral oil to kind of dissolve it and then wipe it off. So we have those, we use those for babies, and we also use them for older kids with severe rashes. Suppositories, there's two kinds of suppositories. There's a vaginal suppository and rectal suppositories. Rectal suppositories bypass the stomach, which is important if the patient has nausea and vomiting. And vaginal suppositories are used mainly to treat vaginal infections. Powders are considered solids because they're finely ground up bits of solid, but they can be packaged in some forms that allow them to be sprayed like liquid dosage forms. One of the main uses of powder is to reduce the amount of moisture in an area. So like baby powder, right? If a baby has a rash, you put baby powder on their bottom and it helps keep them from getting the rash. A lot of times adults will use powders to absorb liquid in areas that get a lot of sweat so that they don't get heat rash. So you'll see that a lot, and it's considered, a lot of times you'll find it in the same area of the grocery store where you buy bath soap. The routes of administration is like, you know, the route on a map. How do you get there? So what we're talking about here with routes of administration, how does the medication get into the body? Oral is by mouth. They're very convenient. They don't need to be measured because you already know that one tablet has a certain amount of medication, so you don't have to measure it out into a spoon or, you know, a measuring system or anything like that. You don't have to measure it like with an oral syringe. They're less expensive. They last longer. They don't They don't break down as easily as liquid medications. They're less expensive. They're systemic, which means they go through the entire body once they break down in the stomach. And they're safe because let's say that if a patient accidentally swallows 10 tablets, if you find out about it quickly, you can have them vomit and get rid of all those tablets. However, it takes longer for them to work because they have to be dissolved in the stomach. They have to go through that first pass effect, which is where it passes through the liver, it gets transformed into something the body can use, and then it goes throughout the body. So they take a little longer to work, but they can be safer, and they can take it at home. They don't have to patients don't have to go home and try and give themselves an IV. But some drugs can't be taken orally because they're not as effective if they go through the body and get dissolved. Now, if you compare that to injected drugs or parenteral drugs, they go straight into the bloodstream. If it's an IV, if it's intravenous, you're putting it directly in the bloodstream. If you're injecting something intramuscularly, they're also going to get absorbed into the bloodstream very quickly. However, if you give someone an IV and it's not the correct one, then it's much, much more difficult to get it out of their, you can't get it out of their system, it's in their system. So you have to give them a counteractant to that. And so the IV is much more dangerous, much more expensive, but it's also a lot quicker, okay? So that's the comparison then with the parenterals. Sublingual is under the tongue. This is the most commonly used sublingual tablet, nitroglycerin. So nitroglycerin goes under the tongue, and you don't wait for it to dissolve and then swallow. It goes straight into the little capillaries under the tongue and goes straight into the bloodstream. So this is the only oral tablets that are absorbed much more quickly. So that's why they made them sublingual. A buccal or buccal agent, I've heard it pronounced both ways, are placed between the gum and cheek where the medication penetrates the mouth lining and then enters the bloodstream. And there's should be a picture in your book, I believe, on page 113. And it shows the buccal tablet, and they're putting this back behind the molar, but as long as it's somewhere between the cheek and gum. And then the sublingual tablet, it shows under the person's tongue there. So that's on page 113 of your book. And there's pictures or illustrations throughout this chapter. So, you know, it's a good book. I like the way they show this. One of the pictures I like on page 109 is a spacer for an inhaler. So here you see the inhaler being used directly by the patient. They spray, they push down on the inhaler, and they inhale the medication directly. This is called a spacer, and there's different types of spacers. One's called an aero chamber. They press the medication, they activate it, the medication goes in here in this little tube, and then the patient inhales it. Now, the reason for that is because some people have a hard time coordinating the pressing and the inhaling. So they press and the medication goes in their mouth and it sticks to the side of their mouth, and then they try to inhale it and they're not getting good use of the medication. You have to almost start inhaling, then press the inhaler, and then while you're inhaling, it goes straight down into your lungs. And the reason they use the spacers is because for a lot of patients, they would feel the spray on the back of their throat. They're absorbing it into their bloodstream through the throat, and it would make them shaky. They would have the side effects, but it wasn't necessarily getting into the lungs where it needs to work. So they use a spacer for that. So that's on page 109. And it also talks about the nebulizer equipment on page 109. Rectal agents are, of course, given to the rectum, and they're used for a person who's vomiting and can't take oral medications, or for reducing inflammation. Either ointments or creams can be used in addition to or instead of suppositories. Rectal agents usually work on a specific site and not systemically. However, sometimes they do get absorbed systemically. So I kind of have an issue with that statement. They can be uncomfortable. Most of the time, once the rectal ointment or cream is in the area, they don't know it's there. They don't feel it after that. But sometimes it can feel squishy if it's an ointment or a cream, and patients don't like that squishy feeling, of course. And so the actual amount of drug that's absorbed is hard to predict because, of course, the rectum area can have fecal matter. And if the cream and ointment doesn't come into contact with the side wall of the rectum because of fecal matter, then it's not going to get absorbed. So the amount of drug absorption is hard to predict. Okay, topical agents, the effect can be localized for rashes, or they can be systemic. Most of the time, topical is not going to be very much absorbed, though. It's absorbed a lot less than medications that are taken by mouth or parenterally. These agents can fight skin infections, inflammation, and block the ultraviolet rays of the sun, so you can use it for sunscreen. You could use it for like Neosporin for an infected cut or to keep a cut from getting infected. Or if somebody has a rash that's itching and it's all red and inflamed, you could use that to bring down the swelling and stop the itching. So they work at the site of action or they can work systemically. So the advantage is they're easy to apply. The disadvantage is they can cause a reaction. The term parenteral is Greek in origin, and it means side of intestine or outside of the intestine. The most common given parenteral medications are given IV, which is intravenous, IM, which is intramuscular, or SC, which is subcutaneous. Very small gauge needles are used. The length depends on the injection site because you want a longer needle if you need to go through all of the skin and into the muscle. Parenteral drugs usually work within a few minutes, and this is important for emergency situation, for patients who are combative, or for those who are unable to swallow. The disadvantage is there's an increased risk of infection with parenteral drugs. Injections are more expensive and require preparation and administration by trained personnel. The disadvantage, if the patient is allergic or if too much drug is given, there's very little time to alter the course. So in other words, like I said, you can't make them vomit and get rid of the medication. I read a lot, as you can tell, I have a ton of books. Then I have 13 of these bookcases in my house. So this is just a very small amount of books. I love to read. And so I was reading a book by a very popular author of vampire romance novels, which, you know, those are the best kind to read, right? And so in it, this vampire is given an injection of heroin because somebody wants him to be out of the way. And they just happen to have heroin around, and they inject him with it. And so he realizes what's going on. He needs to go react quickly, but he's already starting to just, you know, pass out from the heroin. So he grabs a trash can and he sticks his finger down his throat and he makes himself vomit to get rid of the drug. And I read that and I was just like, okay, this author works in healthcare. That's what she did before she became very rich from writing vampire romance novels. And I had to laugh because you can't get rid of something that's been injected by vomiting. It cracked me up. But the rest of the story was great. So, you know, if that's the only problem I have with the story, then that's fine. Okay, so drugs for the eye, ear, and nose. Ophthalmic solutions are things that go in the eye. Now, you can use eye drops in the ear, okay, which are otic solutions. But you can't use things for the ear in the eye because eye drops have to be sterile for one, and for another thing, they can contain things for ears that numb the area, like for an ear infection that's painful. Then you don't want to put that in the eye. You don't want to put numbing agents in the eye unless, you know, without the doctor's permission. So mainly it's the sterility issue, because if you put something in your eardrum is pretty much going to keep it from getting into the rest of the body. So it doesn't have to be sterile. It should be clean, of course, but it doesn't have to be sterile. Eye drops always have to be sterile. So remember that you can put eye drops in the ear, you cannot put eardrops in the eye. Okay. All ophthalmics must be kept sterile. That's why they tell you with eye drops not to touch the dropper to the eye, because if you have an eye infection and you go to put drops in your eye and you touch the dropper to the eye or to the tears around the eye, then you're going to contaminate the bottle of eye drops. So you don't want to do that. So here's an example of a dropper. Different types of agents are available for the eye, ear, and nose, including ointments, solutions, and suspensions, and the dosage forms work on the specific sites. You're going to have different things for each area. However, you could have something like ciprofloxacin, which is made in an eardrop and an eye drop. It's a very strong antibiotic, but they're not going to be exactly the same in each case. So you could use the Cipro eye drops in the ear, but you can't use the Cipro eardrops in the eye. Most ear treatments are done to either clear up infections or clean out earwax buildup. They use a special type of peroxide for ears. It's not the peroxide that you buy in the brown bottle. It's a different percentage of peroxide. And so when you put a few drops in the ear, you'll hear it snap, crackle, pop like Rice Krispie cereal. And so you wait a few minutes and then you flush it out with warm water, and that cleans the earwax out of the ear canal, because the peroxide will break up the earwax and make it easy to flush out. So that's one ear drop. A lot of nasal sprays are used to treat colds and allergies. And then a lot of what they do is to bring down the inflammation in the nose so that the nasal secretions can come out, and stopping the inflammation also stops more mucus from being produced. Eye treatments are for infections, inflammation, and glaucoma. Glaucoma is high pressure inside the eyeball from having too much liquid in the eye. People can go blind from glaucoma. So eye treatments for glaucoma are aimed at letting the fluid, the vitreous fluid in the eye come out. So it opens up the little canals that let the eye fluid come out and get absorbed back into the body, or for inflammation as well. Inhalants are used to treat lung diseases like asthma. There's different dosage forms, but they're effective if they're used properly. They're used for asthma, bronchitis, or emphysema. Corticosteroids are also available in metered dose inhalers for chronic conditions. There's two types. There's a propellant one and a dry powder. So you can actually have an inhaler that dispenses a dry powder. And on page 108, it shows two different ones. So this one is a regular propellant inhaler. And this one, which I'm having a hard time getting the camera to focus on, is a dry powder inhaler. The one on, I believe it's the teal colored one, and it's more of a square. So when you press the actuator, it punctures a hole in a little capsule that contains powder. And then as you inhale, the powder goes into the lungs. So, and they might feel kind of weird going in because it's very dry. Okay, aerosols come in little handheld units, and they're very effective and convenient. The disadvantage is that if they don't do it correctly, then they don't get the medication into the lungs, and they don't get, it's not as effective for them. Injectables are long-acting parenteral drugs that are available to be used in place of daily dosing. Okay, there are some long-acting drugs that should not be given by IV. Okay, they should always go intramuscular. Because then the body absorbs it from the muscle at a slower rate. And they can actually last for up to 30 days. One of them is, I believe it's Haldol that they can use that way. Okay, miscellaneous routes. Things like suppositories, ointments, foams, and gels can be used vaginally or in the urethra. Urethra is where urine comes out. So there is a little tiny pellet that actually can be used for men in the penis. And a lot of men look at that and go, I'm not sticking anything in there. And so it's very unpopular, does not sell well. obviously, because most men don't want to do that. These things can be used to treat infections and inflammation. Vaginal foams can be used as a contraceptive. The advantage is they bypass the rest of the bloodstream, so they don't have a systemic effect on the entire body. But the disadvantage is they're not easily applied and they can be uncomfortable. So these dosage forms were created based on the results from lots and lots of clinical trials that delve into the pharmacokinetics. Pharmacokinetics is where the blood goes in the body, or the drug goes in the body. And most of that depends on the bloodstream. How does the medication get into the bloodstream? And it could also talk about the function of drugs in experiments. And so they look at all these different studies and they decide this drug is better in a patch, or hey, let's make one that you can spray under your tongue. If it doesn't work, then they don't make it that way. Pharmacokinetics encompasses the many different components of the actions of the body on a drug. So once the drug gets into the body, then how does the body change the drug? And on page 117, it shows absorption and receptor sites on the tissues. So part of pharmacokinetics is the level of the drug throughout the blood and tissues, the absorption of the drug throughout the body, the overall distribution in the body, the reaction of the drug with other drugs, the reaction of the drug with things like herbs and food that we eat, patient compliance. Patient compliance is, are they taking it the way they're supposed to take it? Okay, if it's something that they don't like doing, then they're not going to use it like they should. The life of the drug, the bioavailability, that's how much is available once it gets dissolved. The half-life, the bioequivalence, and elimination. Elimination is how it gets out of the body. Pharmacodynamics is the effect of the drug on the body. Absorption is how much of the drug the body actually takes in and is able to use. Medications are made to get through natural body barriers such as the skin, stomach, intestines, the blood-brain barrier, and other membrane tissues. And how well the drug passes through these barriers is the one factor that determines its ultimate effectiveness. Because if you take, say, a tablet, and then later, or let's say you give a tablet to your child, and then later, you look in the toilet and you see that the entire pill is in the toilet. Did they get any of that pill? No. So how effective is it? It wasn't very effective at all, right? So that doesn't happen often, but you sometimes see that. There is a type of tablet that has a really strong coating. It has a little hole in it, and the drug comes out through that hole. So later, when you eliminate the shell, patients, and this is a specific blood pressure medication, and patients would say, hey, that thing went right through me because I saw it in the toilet, and so how helpful is that? But they don't realize that that shell is designed to not break apart because it releases the drug at a specific rate. So the shell is left, but the drug came out of the shell and it got used in the body. So sometimes pharmacists have to counsel patients that get those particular drugs. I think one of them is Cardizem CD. Distribution is what happens to the drug once it gets absorbed. After a medication is absorbed, it's distributed throughout the body through the bloodstream into tissues, membranes, and ultimately organs. Distribution of the drug is not necessarily equal throughout the whole body. Most drugs bind to blood proteins to some degree. So Xiomara and Romano, do you guys have any questions so far?
No, I don't.
Okay, good. Metabolism changes the chemical structure of the original drug. Now, most metabolism takes place in the liver. That's the #1 place that metabolism takes place. However, what a lot of people might not realize is the second most common place that metabolism takes place is the kidneys. So some drug like ibuprofen is mostly metabolized by the kidneys. Most other drugs are mostly metabolized by the liver, and especially Tylenol. If a patient takes too much Tylenol, why that's very harmful for them and why so many people can actually die from too much Tylenol is because it overwhelms the liver and the liver starts to fail. But you can also take Tylenol and ibuprofen in small amounts at the same time because they don't get metabolized in the same place, okay? So, you know, that's a very good thing to know there. Different things can alter metabolism. A patient's age, their gender, their genetics, their diet, other chemicals that they've ingested, herbs that they're taking, things that they eat, garlic, a lot of garlic in food. There's this thing called the Generally Recognized as Safe, GRAS, and it's a list that the government puts out. A lot of different governments put this thing out, and Germany has a really nice list. Germany's done a lot more research on herbs than the US has. So that's one nice thing I can say about them is they know more about herbs than we do because of their studies. But anyway, this Generally Recognized as Safe list has a very small list of substances on it. And one of the substances that's not on it is garlic, because apparently you can harm the body by just eating clove after clove after clove of garlic, like, I don't know, way too much. Not good for you. Garlic is good for you in small amounts. It lowers your blood pressure. It helps with, I believe it helps with cholesterol. But anyway, so we don't know enough about different herbal products and what they do. We know what we think they do, but they haven't done a lot of double-blind controlled studies like they do in countries like Germany. Okay, there's this thing called the first pass effect. So for some drugs, when you first take the drug, it dissolves in the stomach, it goes into the bloodstream, and it doesn't do very much until it gets to the liver. And that's where that metabolism takes place. And then the drug actually gets distributed in a form that the body can use. So your body has used up some of the drug before that happens. So the first pass effect lowers a drug's bioavailability. So first pass drugs are given in larger doses for that reason. Okay, elimination is the last phase of a drug's life in the body. Elimination is where it comes out of the body. So how does the body eliminate the drug? It excretes it in different ways. It can come through the kidneys, the feces, it can come out in your breath as you exhale. It can be sweated out through the sweat glands, or it can come out in breast milk. But urination and bowel movements are the most common methods of excretion. This is why some breastfeeding mothers need to watch what medications they take, because it can come out in breast milk and affect the baby. So for instance, if a woman is taking a medication that lowers blood pressure, but it comes out in breast milk, that's not necessarily good for the baby, because maybe the baby does not need their blood pressure lowered. The bioavailability is the rate at which a drug makes it to its destination and becomes available to the site of action for which it is intended. So if someone is taking medication for a headache, it's going to act on the nerves that tell the brain that their head hurts. So how much of it gets to that site to tell, you know, to those nerves to tell the brain that the head hurts. So how much of it is available when it finally gets to that point, and how much of it has already been broken down and eliminated. Different drugs clear in different ways and at different rates. Many drugs, you know, have to go to the liver first. So the first pass effect really does affect the bioavailability, and a few other things affect it too. The half-life is the amount of time it takes the body to break down and excrete 1/2 of a drug. Let me see if I can find that on here. This is on page 118. An important factor in the creation of drugs is the half-life, because it tells the manufacturer how long it takes the body to get rid of the drug completely. So let's say that you have a drug that has a half-life of 4 hours. I'm going to put this on here because I think it's important and we need to know this. Okay, so let's say that we have a drug that we take 1,000 milligrams of, like Tylenol. And when they first take the drug, it builds up, and in about an hour, you have the whole amount broken down in the body, 1,000 milligrams. And so in about 4 hours, you're down to about 500 milligrams. Okay, so that's the half-life. Now, does that mean that in 8 hours, the rest of it is gone? No, because a lot of different factors affect the excretion of the drug. So the half-life tells you when half of it is gone, but then the excretion slows down on most drugs. Now, some drugs have a really long half-life, and some drugs have a short half-life, but the rest of the drug takes a long time to break down. So something like, I always use the example of smoking marijuana. You might not get rid of the rest of that dose for days and days, or even a month or more. So then they're all different. All the drugs are different in their half-life and how long it takes to get rid of the rest of the drug. So the half-life is helpful because it tells us how long it takes for half of the drug to be gone. But remember, it slows down after that. So the other half of the drug is going to take longer to get rid of, okay? Bioequivalence is where they compare two drugs either from different manufacturers or in the same company from different batches of a drug. Generic drug manufacturers strive to achieve bioequivalence to compete with brand name manufacturers. So this is something that the US government really looks at to determine whether a drug can be considered a generic for another drug. And it has to meet these bioequivalence comparisons. In other words, it has to do the same thing to the body in the same way, in the same time frame, or it can't be considered a generic drug, and they can't sell it as a generic. So the company that makes this ibuprofen couldn't even sell it in the US if it didn't work in the same way as Advil, okay, or Motrin. Okay, excipients are those things we talked about. All medications are prepared with additives. There could be coloring, flavoring, could be fillers, it could be preservatives. Some drugs are so incredibly tiny that you have to put them in a filler or else you would lose it. You wouldn't know where it was, okay? Let's look at a gram, okay? If you take a gram of salt, and you break it down into how many milligrams or 1/1000th of a gram, there's basically 5 grams of salt in a teaspoon. So a teaspoon of salt is only 5 grams. If you break that down into 1 gram and you weigh that out, and then you count the grains of salt, there's 1,500 more or less in our Morton salt that you buy at the grocery store. You know, not the big kosher salt that you use, you know, for things. No, this is just regular salt. And so there's 1,500 crystals of salt or specks of salt in a gram. So that means in a milligram, there's only 1.5 grains of salt. That's so tiny, I couldn't even show it to you. Maybe I could show it to you on my finger. So how are you going to put that and say, okay, I'm taking my medication, I've got these teeny tiny little specks, that's a milligram. Now some drugs are micrograms, which means you're going to take that 1.5 grams of salt and divide it into 1,000 pieces. You're going to grind that up and try and find 1/1000th of that 1.5 grains of salt. So they have to use these fillers in order to make it a size that you can actually work with. Otherwise, you know, you don't know if you have the correct amount or not, because you can't tell by looking at the teeny tiny powdery bits and microscopic bits. So micrograms are almost microscopic. You could probably see it, like I would need my bifocals, but it's really hard to see. And that's how powerful a lot of these drugs are. They are so powerful that you only need microscopic amounts. So we have to put it into a larger form that we can actually see and hold and count. Okay, so this is 200 milligrams. Okay, or 200, or about what? So I'd have to do math on that one to see how many little grains of salt are in there, but not a lot for sure. So you have to, you're basically enlarging it so you can work with it, okay? So some patients could be allergic or intolerant to the additives. Other types of excipients increase the dispersion of a drug once it reaches the intestines, or they release the medication over a longer period. So drugs have to have these excipients. Okay. The ever-changing world of drug manufacturing has made availability many, many different choices. So now we know that a tablet's not just a tablet. There's many different types of dosage forms depending on the desired effects of the drug in question. All of the dosage forms have to be approved by the Food and Drug Administration in the US, so the FDA. Medications are packaged according to the manufacturer's specifications to ensure the effectiveness and shelf life of the drug. So for instance, these tablets expire in October of 2021. So let's look at the tablet again. Okay, this tablet's going to expire in 2021. So what does that mean? Does that mean there's no longer going to be drug inside this tablet? No. It means that this manufacturer is not going to guarantee that if you take this tablet, it'll work the same way. In fact, they don't want you to take it after that amount. Some medications like tetracycline can actually become harmful after the expiration date. So the expiration date is a legal document or a legal agreement that says that as long as you store it in a cool, dry place that's not too hot and not wet, that it will work the way it's supposed to work up until that point in time. After that point in time, they don't guarantee it to work and they tell you not to use it. So it's a legal liability. I'm not going to take responsibility if you take it after that date, is what the manufacturers are saying. Okay, and they also have a package insert that describes the storage and stability of the drug. So on here, it has a bunch of warnings, and there's a stomach bleeding warning. That's, you know, something that you see a lot on non-steroidal anti-inflammatory drugs. They can actually cause ulcers. And then this has this, a lot of people don't know that if you peel the label, there's a lot more information on the inside of some of these drugs. And the storage, store at 20 to 25 degrees Celsius, which is 68 to 77 degrees Celsius, or 68 to 77 degrees Fahrenheit. Avoid high humidity, like in the bathroom. You're not supposed to put your meds in the bathroom. And excessive heat above 40 degrees Celsius, which is 104 degrees Fahrenheit. So all of this information is on the inside of this label, which, you know, a lot of people don't bother to open up and read. So I thought that was interesting. A lot of times all of this information is actually on a little insert that's inside the box when you buy the medication. Okay, then it's going to talk a little bit about medical terminology. Okay, there's 4 segments or word parts in medical terminology. The prefix is before, it's in the beginning of the word. Okay, so what they're talking about here is, let's see. Okay, on page 123, it gives you a lot of examples of this, the medical terminology. Now, we don't cover a lot of medical terminology because it's mostly used for nursing and for med school, but it is good to know a lot of these things because it tells you the condition that the patient has. And anything that ends in itis indicates swelling. The root word, what that they're talking about here, cardia, is the heart. And they're using a combining form, which is the O on the end of cardi, like cardio. And the prefix is the peri, and the suffix is at the end, the itis. So pericardioitis or pericarditis would be swelling of the heart. And peri is a part of the heart. So like I said, you do not need to memorize page 122 and 123. The very first part on page 122 at the top, additional abbreviations, that would be a good thing to know, but I'm not going to, I'll let you know actually if I'm going to quiz you on any of those terms so that you have time to study them. And you're not expected to know all of the medical terminology, okay?